If you want to know what sports PTs are missing with treating athletes in 2023, you need to tune into this episode. Uh, Hi, everyone. Welcome back to the podcast. Welcome all new listeners and welcome back to those who have heard my content in the past. If you want to know what sports PTs are missing with treating athletes in 2023, you need to tune into this episode. Before I go into the podcast, what is new in life? Absolute chaos in the best way possible. I'll tell you a couple stories, but for those of you who've been along this journey with me and understand the wild ride that I'm on, especially with my kids, you'll appreciate this. My son Jacob hit his head pretty good. A nice little goose egg on his head last week, then did it again. We took him in for possible injuries and they said it was all clear. And then the next day, then just shreds his hand into looks like pulled pork, or his finger, because he was put his hand in a like a bike, a stationary bike, in one of the pedals, and it just got twisted. And so he has had quite quite the road in the last week. So that has been great. Just trying to navigate that. Everybody who knows how I approach challenges, it's always what's next with babies and kids. That's just part of the ride, and you get better at triaging what can be big and what's not. And as a parent, you figure that out kind of fast. You start Googling a bunch of things, start talking to people, texting friends. We have friends who are pediatricians, who are nurses in the emergency room. So we try and use the resources wisely before we make decisions. So that's great. My son Zach is reading sentences now, and that's so cool to watch humans just develop new pathways in the brain. My daughter is spicy as ever, and my wife and I are just trucking along. We just had our 2022 holiday party for sports performance, and that was fantastic. Very nostalgic for those who saw the photos online. Very nostalgic for me to see that journey, and 16 other great humans that are on this path to improving lives. And I want to share some things that I have taken away from conversations I've had over the last week, especially over the last week. So I'll tell you as we go into this podcast, why did I do this episode? It's kind of been building after all these recent episodes in like talking about this new age, new wave patient and athlete. They're very well informed. They know what they're doing. They've seen other people before. Their primary care was more of a consultant. They just wanted to like get a script, or they wanted to know if anything major was there. And so they're now using physical therapists in a different manner. They're really looking to the therapist as a consultant. Especially those who have been around the block. They've done therapy before. They're like, well, I can just go to this person. They kind of know already what I need to do. I just need to get what I call the green lights, the yellow lights, and the red lights. And so as you approach more and more of these athletes and patients who are well informed and they know what they want, or the parent is, so say for instance, you're seeing youth athletes, you're going to come across people whose parents are very well informed, and they want answers, and you as a therapist now has to figure that out. So I really wanted to share what I'm seeing with sports PTs and how you need to change that model going into this upcoming year. So at the time of this recording, it's December 2022 going into 23. And this is going to, no matter what the year or the date, it's going to be really very relevant for you wherever you are in your career path, because these patients and athletes will push. They will push and they will challenge your professional development. So I want to share, and so I'll go on. Let me give you the whole premise of this podcast episode. It all starts, if you're on my newsletter, it starts by watching PTs do these twisty, bandy, rotational exercises, and I'm all for them. I think exercises are fantastic. But what I think people fail to do, they see it on Instagram, they see it on social media, and then they want to implement it at their facility because it's like what athletes do. It's what active people do. It's sexy. It's a great exercise. It's a sexy exercise, and people are drawn to that. And maybe your patients or athletes will. But the problem becomes what's right behind that twisty, bandy, rotational exercise. Like what's next? You're going to keep searching, you'll keep finding it. And for many of you, you'll continue to seek that from social media, from YouTube, Google, whatever it is, when in reality, You don't need those things. And I want to flip how you view treating athletes in 2023. So when I ask you, what's the best exercise to do with somebody to manage a high school soccer athlete who's in season and is having knee pain, non-traumatic knee pain, just insidious onset, in season, they have 12 more weeks of high school career. What do you, like, how do you, what's the best exercise? And for some of you, you're going to be like, oh my gosh, but what's his ankles look like? What's his hips look like? What's his back look like? What is his, I don't know, patella look like, right? Everybody's going to go to the same different thing. If I say, what's the best exercise? Some are going to go like, oh, I'll do clamshells. I'll do a single leg RDL. I'll do a back squat, do a deadlift. I'll do a single leg squat on a raised surface, on an incline. I will do a protocol of whatever. I'll do manual techniques. Everyone's going to have a different flavor. And what you need to do before you answer that is you got to stop thinking about the answer first. Don't give me the exercise. Don't give me the result. Don't give me the thing that you would do. I want to know why, in what context. So the best thing to do is don't give the sexy exercise. So then you're like, well, as a clinician, what do I do? The first thing you have to ask, figure out what happened, right? Always look in the past. Where's the root of this, right? Something volume based. Something happened to, if it's insidious onset, it's because it was too much volume or intensity over a given period of time. That's just the nature of what happened. You have to figure that out first. If you don't understand that, you cannot be a sports PT. You will be an Instagram PT who happens to do twisty bandy exercise. If you really want to be a good sports PT, you got to figure out the framework first. What happened? It was a volume and intensity problem. So, for instance, he didn't practice for months, then decided to join the soccer team. There was basically no build-up, no general preparation phase. And now he's in this hole where he went too hard too soon. So his acute to chronic workload ratio is very high, meaning he or this individual, this person, he or she, went out too hard too soon. So now you got to figure out, okay, if that was the problem, now you got to figure out what's your timeline to get to the goal. So if I said, hey, he's got, I don't know, 10 weeks to get to a playoffs, how are you going to control this? He's in season, so you can't rest him. If you rest him, he might lose his position. He or she might lose the position. So what do you do over the next 10 weeks to manage his knee pain? Well, then that's the art and the science. It has nothing to do with exercise. Nothing to do with exercise. It becomes, how do you control the variables outside to mitigate or reduce the strain on that for the next 10 weeks? Because they need to practice. So if they need to practice 3 days a week, right? And 2 days a week are off and 1 day's game. So Tuesday, Thursday, Sundays are off. Monday, Wednesday, Fridays practice. Saturday is game. How do you manage this? Do you allow them to practice? I think you have to. Do you need to reduce the volume intensity? Yeah, I think that's fair. Volume of running or impact or deceleration based things. What about intensity? Great, keep them above. So if he's got 10 weeks out, maybe you start him at 50, 60, 70, 80, 90, 100% over the next 5 weeks. From there, you work backwards. You're like, all right, I got 10 weeks to figure this out. They're going to reduce their volume and intensity right now because it's early in the season. He doesn't lose a position, but he's just going to be deconditioned at the moment. So we'll put him on the bike to put him on workouts. So Tuesdays and Thursdays, we're going to have him do cardiovascular sessions. Monday, Wednesday, Friday will be technical skill at practice, but we'll decrease the intensity, no deceleration. And if it's the stance leg, no kicking the ball far because that's a deceleration leg. So now you have to look at all these variables. That's going to help reduce stress and strain. You have to figure that out first. Once you can reduce the strain, you look at a forecast. You got 10 weeks. You have 5 weeks to build them back up to 100% volume and intensity. Then you have 5 weeks after that to get them in play without any flare-ups. So if you're giving yourself that calendar, now you got to work backwards. So what are my parameters for exercises? Are you in a strength phase? No, because you're in season. So you're not getting them stronger. You have to realize that. You're in season. The central nervous system can only handle so much. You can't do 6 to 8 reps and build volume when you're trying to develop actual skill because they're very difficult, they're very slow. They're in season. So what are you going to do? What are your rep schemes? Are you just doing for like endurance? Are you just doing neuromuscular re-education? What's the focus of this phase for the next 5 weeks? Let's do neuro re-ed. Okay, cool. Let's do 12 to 15 repetitions, 10 to 12, whatever you want to call it. Great. That determines your workload. That determines how many reps and sets you can do. Because if you're only doing 12 to 15 reps, you can do a higher number of sets. So if that's the case, now you're working backwards with your parameters. Now you've realized over the next 5 weeks, we're going to do your neuromuscular control. After that, for the next 2 to 3 weeks, we're going to build a little bit of endurance and then get them back onto the pitch with faster speed and plyometrics. But now your parameters are dictated by your phase of healing. So now you're at 12 to 15 reps. So that tells me, okay, great. You're not going heavy, so your load is going to be low. Got it. What's the focus? Neuromuscular control, work on deceleration. Great. So you have to pick your primary movements at the beginning of the session so they're not overly fatigued. You're doing box drops. You're doing a deceleration, steps. You're doing ladder drills. But you're not going to do high volume with those because those are skill-based things to teach them proper mechanics. So now you've worked backwards, and then you get to actually choose exercise now that you have the parameters. So if you knew that you had 5 weeks to work on them, 12 to 15 reps, you're doing 4 or 5 sets, and you're working with them for an hour, 2 days a week, they're working on conditioning on their own, non-weight bearing or partial weight bearing, so like on a bike or a little bit of resistance. Now you go backwards, and that final step is what exercises meet those demands. And for many physical therapists, they've never thought like this. For many physical therapists, they went straight to the exercise to achieve the goal, the short-term goal of activate the glute, get the quad to turn on, stretch the calf. But they never put it in context of a phase of healing. So for instance, the only time you've ever done this, maybe, is a post-op ACL, post-op meniscus, post-op rotator cuff repair. And that's great, but why aren't you doing it with everybody? Why aren't you doing it with non-operative, non-traumatic? It's funny how the brain doesn't spin that direction because you're like, well, why do I have to forecast weeks out? Because they probably have a target of something that they want to achieve. The problem is now you have to break down those into plans of care or phases of healing. And then you have to choose the parameters that you're trying to achieve within that phase. Are you working on strength? You're working on endurance, neuromuscular control, plyometrics, speed, agility. And once you can identify that, now you're in a position where now you can choose the best exercise that fit that phase of healing or phase of return to sport. From there, you can then decide, well, now, if you ask me that question again, if I ask you, okay, what's the best exercise? Well, the question you have to ask is, how far out is the target? How far out, how many weeks do I get with this person? What's the phase that I'm in? Are they out of season? Are they in season? Are they postseason? And then if you can see that, that changes everything about the exercise you would choose. To tell you the truth, the exercise is irrelevant. The plan is the end all be all. And if you can understand that, you've been able to help athletes and patients right now. The way you help athletes and patients is you provide the quick solution to get immediate results, but they won't last because you haven't put it in context of building something over time. And some would say, well, it's a pyramid. At the base of the pyramid is strength. On top of that is endurance. On top of that is flexibility. On top of that is neuromuscular control. On top of that is speed, agility, and technical skill. But now you have to actually look at it from, if they're injured, you have to flip that. Flip the triangle upside down and say, do I have time to build this strength? No, you're in season. You don't have any time. So now you got to work on that endurance, neuromuscular control, balance. If they're off season, now you have opportunity. Now you have time to work on this. If they're in season, you do not have a lot of time. And that's where we fail as clinicians. You usually see people post-op. Well, that's pretty much off season going into preseason. It's the only time you've been able to benefit people in that realm. In 2023, when you get these well-informed patients and athletes, they want answers and want a plan. And some of the most common orthopedic PTs, I'm going to be polite here, will go week by week. Week by week. Worst thing you can ever do as a clinician, because there's no plan. The reason why you're going week by week is because you don't know what to do. Whether you're a new grad or established clinician, you've been guilty at this at some point. I have. I get it. But now I'm trying to map out everybody as much as possible. And even in my own personal fitness and everything I do with sports performance, everything I'm trying to do, I'm trying to map that out. Now here's the downside. Here's where I'm going to hit you in the face with some truth. You don't like being wrong. So what's worse is you don't provide options and a plan because you don't want to be wrong. So that's why you'd rather go week by week so you're not wrong. But here's the reality for patients and athletes, especially with well-informed ones in 2023. They don't care. All they want is some direction, not perfection. So if you're a 3.9 or a 4.0 PT, this hurts because you're like, you got to give in at some point. You got to stop fighting the fight because you're providing a disservice to your patients and athletes by not giving a tentative plan. And for some of you, you're like, well, it can change. I mean, like, what about week 4, week 6, or week 8? How do I know what's going to happen? It doesn't matter. Give them an estimated guideline, a plan. And I call it my athlete treatment guide. And this is what I do with every single person. Some call it a plan of care. I like a guide. It helps them understand what is coming down the pipeline, what they need to be able to see. You might be able to play at week 8. Now it gives them hope. However, that's if everything goes to plan. That means your roadmap has to be solid. But if you can't do that, now you're stuck. But now if you go week to week, you can never be wrong. I've seen it too many times. And if you're shaking your head, you're guilty of it too. Stop going week by week. Let me share something that I shared with a PT recently this week. All right. Leading people, which is what you do, right? You're mentoring, you're coaching people through their health, right? As you lead people, the hardest thing to do is get them to achieve results, right? There's 3 factors in this. One of them is, do they have like strong motivation? I call it will. Do they have strong motivation to achieve the result? And you know, those people are like bright-eyed. They're like, yeah, I just want to get better. And like, I want to get better fast. I want to get back to the soccer pitch. I want to get back to the basketball game, whatever it is. Here's the other factor. One side, you have the will, the passion, the motivation to get strong. Like they have to have that, right? The difference between their motivation and the result they want is one big piece, and that's your skill as a clinician. It's the piece that will get them to that part. So you have will on one side, you have skill on the other, and you have results. The difference between will and results is skill. That's why they're coming to you, because you have a skill that they don't. They have motivation. They're like, I've Googled it, I YouTubed it, but I just don't know how to do this. And you're over here like, well, I have all the answers, but I'm kind of scared to not give you everything or to give you everything because I don't want to be wrong. So I'm going to have you come back week by week so I can tell you you're actually doing a good job. When in reality, I know I can push you a little bit more, but I'm not sure if you want that. So I'm not going to tell you that. So I'm just going to like guide you little by little and just not push you too hard so I don't flare you up and risk being wrong or being seen. So at least if I go conservative, you at least get like 50% better and I'm not wrong. So I'm not going to look like a bad PT. You have more skill than that. The person with high will, the like motivated patient athlete, wants to be pushed. Your skill set to get them results will be the gap in happy customers or happy patients. And it's the truth because I work with those athletes and it's the thing they tell me on a regular basis. I just wish other PTs would push me a little bit more. I wish they would be honest about like the projected plan. At least I have a general guideline. Most patient athletes come to see you for the guideline, just the roadmap. They want to know estimated timeline. Can I do this or not? They don't want to know if it's a meniscus and it hurts every time that you go into slight knee flexion with a little bit of tibial rotation, and all you have to do is turn on your glute and not walk this way, or maybe turn your feet out a little bit. They don't want that. That's a short-term fix, but what they really want is, in 6 to 8 weeks, will I be able to run my race? And if you say yes, the next question is how. You're gonna like, well, let's just come back next week and let's talk about it. That didn't solve their problem. What they wanted is a week by week progression to get them week 6. The problem is you don't think like that and you don't have the answers to that and you're scared to be wrong. So if that's you, what you need to do in 2023 is start creating week by week progressions on everybody you see. People with start with this, start with really motivated people, right? On the back end requires you have to work after your actual like treatment times. I don't know if that's going to be okay, or weekends or nights. You start working on projects to actually help yourself move forward. I had another conversation with somebody this week. You ever feel like you are always working, you always have something going on, you never really get to say, like, you're always drowning in paperwork, you're always drowning in programs, you're always doing stuff, you're always just doing. And somebody shared that with me earlier this week. They just felt like, man, I can't get caught up. I'm always having stuff. And I said, how much time do you spend on creating things so you don't have to duplicate them, so you can duplicate yourself? And they said, not too often. I do, but not very often. And I said, why are you just doing? Why don't you start creating things so you don't have to keep replicating them or duplicating them? So for instance, programs, week by week progressions. Once you do one with the first shoulder, non-operative shoulder, you just need an operative one and you're done. And then a knee one, operative, non-operative, and then you're done. So if you can get to that point where you have all of these plans of cares and roadmaps and general templates for each one, you're going to be in a good place because you'll be able to identify things quicker, provide roadmaps so much faster. But the problem is, it's all the time building that curriculum, or all the time building all those templates. And if you don't have what I call the playbook, if you don't have any of those things in your playbook, you will always be doing. You will always be swamped in home exercise programs that nobody does, in documentation that nobody reads, in progress letters that nobody reads. And so what your goal is to actually produce things that you can continue to refine and reshare. And even though it is personalized, it's a general template, but you can customize it to whatever they want. And the minute you can do that, now you're moving. Now you can actually have a quality session, even if you're limited by treatment time. So say you work in a facility that does 15-minute treats, 20-minute treats, 30-minute treats, 45-minute treats, or an hour treats. Time is irrelevant. As long as you have something that is reproducible and you can continue to provide value to people, that's all they want. So if they have a roadmap and it's a shoulder, non-operative shoulder, and they wanted to be able to throw a football in 8 weeks, but the template you have was 12, it's okay. Shorten down those things, and then you're set for the rest of your career. And the more you can do this over time, you have this huge playbook of things that you can provide to people. And if you ask me how I've been able to do more things with athletes over time, it's because of that. I started doing this like around probably, but it's just me. I'm very like policy driven. Like I'm very document oriented. Like I used to do Excel spreadsheets like crazy. And the reason I did them was because I like seeing frameworks and numbers. And that was my obsession for a large portion of my career. And so by the time I had all these things, I remember in the pros, I was working all the time. And once I built these templates and playbooks, these athletes were like, Chris, let me have, the rest of them. I was like, no. You have to be ready for these. I'm not just going to give you these things. You have to be ready for them because there's no value otherwise. And so when you have people who have high skill, or excuse me, high will, they're motivated, and you have those skill, that playbook and everything else, guess what happens? Results just skyrocket. And for those of you who in 2023 are, we have various things coming up down the pipeline. There's a looming recession. There's all these other things going on. That's all distractions. Just stay focused on your career path. And if you are ever concerned about, what it is that your job security, whatever it is, I'm an employer. I get it. Like, ultimately, you want to take care of your team and you want to take care of the employees and the staff. You as a physical therapist, the best thing you can do is work on yourself and work on your skill. So that's not even a question. I tell people that all the time. People on my team, continue to develop yourself. that will create safety in everything that you do, both the athletes who want to come see you, your employment, everything that you do. And I'm telling you this because I mentor, I lead, I'm a business owner. Like I genuinely, this is how I talk to my staff and my team. The biggest thing you can do is continue to develop and refine yourself. And with all of that, this will put you in a position that you're just crushing it with athletes. Your patients and athletes see what you're doing for them. You're different. You're not just like every other physical therapist who just gave them HEP to go images or whatever the new program is. They want to just know the exercises are great, but the exercises are only a piece of the menu within that phase of healing with an overarching roadmap that has a different phase and different parameters over the next 2 to 4 weeks and a different purpose. And if you can see that at the grand scale, turn that pyramid upside down and stop looking at the sexy exercise, the bandy twisty rotational exercise, and flip it and say, I have 8 weeks to build strength, 6 weeks to build endurance, 3 weeks to build neuromuscular control and plyometric training. I have 2 weeks to work on plyometrics skill development and get their speed up for 1 more week after that. So within that, now I look at my parameters. Now I'm like, okay, if I'm working on speed, what are my reps? If I'm looking at strength, what are my reps? And within that, you're like, how many days a week do I get to train? 4 days a week at 6 to 8 reps. Great. I know my parameters. Now you insert your exercise at the very end. The exercise is the dessert. You have to understand that. The framework is like the steak, the big piece, the main meal, the lasagna, the everything. It's the main meal. Your sides, your veggies, all those other things are the parameters and everything that you set up within this plan. And that dessert is the exercise. You don't get that to the very end. And some PTs focus their entire career on developing the coolest exercise, which is so narrow focused. And if you really want to get a lens like a real sports PT and be able to manage people, and this is how all pro settings are, because you have to work in the context of a year and a season. But in ortho clinics, we're so narrow focused, you go straight to the exercise because that's what was prescribed. That's what the patient and athlete wanted. You're letting them control the plan of care, and you're letting them focus you on what is not important. You don't even know the parameters or their phase, and you don't know the roadmap. How do you provide an exercise? And if you can change that one thing, and you can be honest with them and tell them, here's what it looks like over the next 6 to 8 weeks. It can change at week 3 to 4. So there's a couple things I want you to take away from today. Number one, I want you to communicate the plan of care with confidence. Number one, you got to do that. Confident, look them in the eye. Yeah, you can tell them you have a little bit of wiggle room. Number two, set that roadmap. Your athletes are looking for direction, not perfection. Number three is continue to refine that as you go. I call them red and yellow lights. Like just give them bumpers. Like, you went too far this way. You shouldn't be doing that. Continue to do that. Reassess all of your options on a regular basis. Plan A, plan B, plan C. Like what if it re-aggravates, what if it flares up? You always have to have something ready to rock and roll. And ultimately get them to 90% subjective rating. And if you can do all those things, now we're talking. Now you're in sports PT mode. Now notice I never said anything about an exercise. Doesn't matter. The exercise is irrelevant. So if you want to do the bandy twisty rotational exercise, that's up to you. But I think you're putting yourself in a position where you're putting the least important exercise or the least important thing at the very top. And if you really want to be a game changer and truly change your professional development, start working backwards and work on these other variables. That to me will set you up for success in 2023. And the challenge that PTs have with all of this is that they haven't been exposed to this. If you ask me where I get the framework from, gosh, I just adapted it from strength conditioning specialists. Some of the best in the world taught me, and they humbled me. I was the twisty bandy exercise guy too. Early in my career, I was like, oh, that's sexy. Let's do 10 of those. Let's do 12. You're looking good. Let's do 27. Boom. Yeah, really good. And I remember going back to a strength coach, and they're like, yeah, there's certain nervous systems fried now that they can't even lift a weight because you did 127 reps of this cool exercise. but you failed to realize they have practice this afternoon, knucklehead. And I was like, oh, I forgot to put in context of who else is working on this. How else is it impacting their program? And the coach is like, man, they're sore from doing all that. You messed up my practice the next morning. I was like, oh, guys, I'm so sorry. Sorry. And you just kind of like, you live and learn. And that to me was huge. And I've eaten my humble pie over the years, and that's why I've changed my framework so much, is because I now see it in the context of who else am I working with to ensure this person's safe. And if you see it from just the PT's perspective, that's okay. I just think you haven't seen the full lens yet. And the other challenge that people have is they never seen the framework. And number two is, where do you get education on this? Like, where do you develop it? Do I have to go to sports courses? And honestly, that's why I started the Chris Garcia Academy. This is like why I wanted to do it. You can go a residency, you can do a certified strength and conditioning specialist, you can do, I don't know, these acute injury management on the field courses. I think those are all great. I think they're very contextual based, like you have to learn that piece, but to put it all together in the context of a PT world is where the magic happens. And that's why I created all my courses. So for those of you who have joined me on the Kickstarter coming up in January, I'm awesome. I'm excited to see you there. For those who are looking down the pipeline, what my other courses are, I have acute injury management, my accelerator course coming up in I think it's March or April. And that's why I built my courses, honestly, just to be able to create that framework and intertwine a little bit of athletic training, a little bit of strength conditioning, a little bit of PT, a little bit of primary medicine, a little bit of nursing, a little bit of like PA, a little bit of massage, a little bit of chiropractic, a little bit of acupuncture. Like when you put all those things together, they're magic. I mean, that's just hard. Like you can't be an expert at all of it. And so after learning everything from all these specialties, I put it in context of like, how can we do this in a PT world? How do we adapt some of these things? You'll never be as great as each one of those individual. It's hard. They've done their schooling. They're really talented at what they do. And all I'm trying to do is blend all of those things together. And after doing a residency, I learned like what it can look like. But now, how do you put that in like real clinical practice? In the residency, I learned like, oh, it's nice at a university level where like maybe your funding is different and everything else. But what do you do with like the normal like gym goer, and how do you put that in context of like just the normal community member? And that's what all my courses are about. Are truly, how do we impact the person in the pros, to your high school kid, to your 42-year-old who just wants their life back and they want to go and play basketball on the weekends. So those are the reasons why I develop all these things. That's why I'm telling you, change your mindset, change everything that you do. I think you'll be in a good place. And if you're interested in joining my next course, it is in January 10th. Sorry, January 11th, 2023 is my Sports Beat Kickstarter. It is basically trying to put my background in residency into 8 solid weeks for 2 hours a week on Wednesdays, and going out for 8 weeks on acute injury management, sports rehab, strength conditioning, and injury prevention. So I sandwich all those in 8 weeks. I'm excited to see everybody there. If you're interested in that, go on to my website, drchrisgarcia.com/Kickstarter, and I'm excited to see you there. If not, continue following on Instagram, Chris Garcia DBT, or my newsletter. Either way, I'm excited to be part of your professional development. I hope you're crushing it out there and staying healthy and active and keep changing people's lives. So nonetheless, I will see you guys on the next episode. Take care.